Hello, I'm Dr. Deborah Siegel, a hematologist at McMaster University and proud Thrombosis Canada member. I'm also pleased to have received the Thrombosis Canada Research Fellowship in 2014. And today I'm joined by Dr. Sam Schulman, who's a world expert in thrombosis and hemostasis, and is currently the director of the Clinical Thromboembolism Program at McMaster University, and is also a Thrombosis Canada member. Welcome, Dr. Schulman.
Thank you very much.
Perhaps you could start by telling us about World Thrombosis Day.
This is an exciting phenomenon that started last year when International Society of Thrombosis Hemostasis, or ISTH, introduced it as a day to focus the attention of the world, of physicians, of patient groups, on this phenomenon of thrombosis. So in order to get the attention around the world and spread education and information about it, every 13th of October will be World Thrombosis Day from 2014 and on.
We'll all be sure to mark our calendars for October the 13th. Now I'm interested in hearing a little bit more about Thrombosis Canada and the role that it plays.
Yes, Thrombosis Canada was started actually in 1991 as Thrombosis Interest Group of Canada, but then transitioned into Thrombosis Canada because they wanted a wider involvement of family physicians and other specialties rather than only thrombosis specialists. And this organization has been working with clinical guides on all kinds of different aspects of thrombosis to increase the knowledge and understanding and improve the management for patients. On top of that, there are also small point-of-care tools, calculators, that fit very well into apps that can be provided to physicians so that they have it as a point-of-care instrument to calculate the renal function, to figure out how to manage anticoagulants for surgery. And all of this together makes it like having a consult beside you in the clinic.
I know that I've certainly used Thrombosis Canada clinical applications and clinical guides in my own practice and found it very useful at the point of care. I just wanted to mention to everybody that they can access these excellent tools at www.thrombosiscanada.ca. There are opportunities to read and educate patients from these resources as well. I'd like to ask you a little bit more about your opinions of the recent advances in thrombosis medicine.
Thrombosis in Canada has, during the past decades, been really big. It has been almost dominating in the world with the big faculty of thrombosis specialists we have at McMaster and also other faculties in Canada. Many publications have come out of these scientists. And as a pinnacle of all this, we had the 25th International Society of Thrombosis Hemostasis Congress here in Toronto this summer. I was the president of this Congress, and I think it was very successful. The first day we had, in the late-breaking session, 3 presentations with simultaneous publication in New England Journal of Medicine. The first one was, do we need to investigate patients with thrombosis for malignancy? The other one was about, do we need to bridge patients with heparin or heparin-like substances when we stop warfarin when patients go for surgery? And the third one was regarding one of the new anticoagulants, dabigatran, that their first specific antidote was presented with results from patients who were bleeding or needed emergency surgery and demonstrating that the antidote is effective.
Speaking about the new reversal strategy that was presented in the New England Journal of Medicine and at the ISTH conference, there was a lot of interest among patients and physicians in Canada and the world regarding the management of bleeding that's associated with anticoagulants. Certainly people are working furiously to develop strategies. Can you tell us a little bit about the current treatment options that are available for patients who have bleeding problems while receiving anticoagulants?
Today, we don't have one of the specific antidotes approved yet anywhere in the world, but it's coming soon. However, studies in animals and also case series in patients have shown that already available factor concentrates of blood clotting factors that we have used for other purposes, also work to decrease the bleeding or control the bleeding in patients on the new anticoagulants. And they are available through the Canadian Blood Services, CBS, and through hospitals then also. So, for example, patients who are on factor Xa inhibitors, rivaroxaban, apixaban, we can use prothrombin complex concentrate that we're already giving for patients who have bleeds on warfarin. For dabigatran, which goes in a little bit further down in the blood clotting system, actually at the last enzymatic step of the coagulation cascade, if available, use the activated prothrombin complex concentrate, or FIBA, as some say. There are tools we can use. Patients don't have to bleed to death. But it should be said that actually bleeding is not more common on the new anticoagulants than on warfarin. And in fact, intracranial bleeding is less common on the new anticoagulants. In addition, when we looked, and others also, at the different anticoagulants in the studies, in the large atrial fibrillation studies where they were compared with warfarin, what happened to patients who had major bleeds? The management wasn't more complex, the prognosis wasn't worse with the new anticoagulants than with warfarin. So it isn't, as some wanted to depict in the beginning, a disaster situation. It is manageable, and we are getting increasing knowledge about tools we have to improve the management further.
I also think it's important to mention that in patients who have major bleeding on anticoagulants, that really the cornerstone of therapy is excellent supportive management and early referral for intervention by a surgeon or an interventional radiologist. Thrombosis Canada is currently developing a tool which clinicians can use in their clinic, in the emergency department, to help manage patients with oral anticoagulant-associated bleeding, and that will be available soon on the website. With the new specific antidotes on the horizon and other specific strategies for anticoagulant-associated bleeding complications, how do you think these treatments will revolutionize the field of thrombosis medicine?
We see quite a few patients already on the new anticoagulants. And in fact, Canada was ahead of many other countries. We got the drugs approved earlier than in other countries, but it also was the case that we were involved, or we conducted many of these studies, and therefore cardiologists and other physicians felt comfortable prescribing it. Still, you see about 75% of patients on anticoagulants on warfarin and not on the new anticoagulants. And the reason is partly that patients and physicians are worried about bleeding and that there is no specific antidote for these new anticoagulants. And it doesn't matter really what you tell them about the statistics and what happened in the big trials. They will not use the new anticoagulants until we have these antidotes. So the antidotes may help, although I think the most important effect of the antidotes will be psychological, to convince physicians and patients that now we have safe drugs, we can prescribe them, we can use them, and it will be helpful because many patients with atrial fibrillation who need stroke prophylaxis do not get anything, or they just get aspirin, which is not very effective at all. And if we can get a much larger number of patients on effective stroke prophylaxis, be it with warfarin, but many doctors think warfarin is too complicated to use, too onerous. So now with the new anticoagulants that they will feel are safe and manageable, then we will finally be able to reduce the incidence of stroke in Canada.
Thank you very much for joining us today and for telling us about your thoughts on thrombosis medicine and for telling us about World Thrombosis Day, which is coming up on October the 13th, 2015 and onwards, as a way to increase understanding of the complications of this disorder. Certainly with the new specific reversal agents on the horizon, patients and physicians can feel more comfortable that they will receive effective and safe treatment to prevent thrombosis.
Thank you for having me, and I hope that we have enticed you to get involved with World Thrombosis Day.